Hello, this is Dr. Grande. Today's question is, does comorbid borderline personality disorder and substance use disorder make the symptoms of borderline personality disorder worse? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about borderline personality disorder, we're talking about a cluster B personality disorder in the Diagnostic and Statistical Manual. And we see a number of symptoms associated with borderline personality disorder, including self-destructive tendencies, impulsivity, anger, irritability, mood lability, so having unstable mood, difficulty in relationships, identity disturbance, and a number of other symptoms. And we know that borderline personality disorder has a high level of comorbidity, that is co-occurrence, with substance use disorders. Depending on the research that you look at, it's anywhere between 40 and 60% of individuals with borderline personality disorder will have a comorbid substance use disorder. So quite a bit of comorbidity between those two disorders. Now, both of these disorders can have similar components to them. For example, impulsivity, self-destructive tendencies, and affective instability can be seen across both disorders, and both are associated with adverse childhood experiences. So we believe that the etiological, that is causal factors, and risk factors are similar for borderline personality disorder and substance use disorder. Specifically, some of the adverse childhood experiences related to both of these disorders would be abuse, neglect, and dysfunctional family dynamics. Now, there's been some research on the comorbidity between these two disorders, and we see that there are some different factors that are associated with this comorbidity. For example, with comorbid borderline personality disorder and substance use disorder, we see an increased risk of more severe substance use symptoms. Also, the treatment outcomes are poor. We see an increased risk for suicide, increased self-destructive tendencies, an increased risk of failing to attain remission from borderline personality disorder, and increased impulsivity. But all the research here doesn't point in the same direction. There was a study conducted by Lee and colleagues in 2010 that looked at specifically the borderline symptoms with borderline personality disorder and substance use disorder. So this study was looking to see if the substance use disorder exacerbated specifically the symptoms of borderline personality disorder. So with this study, there were three groups: individuals with borderline personality disorder, individuals who had borderline personality disorder and comorbid substance use disorder, and a control group that did not have either disorder. Now, all the participants here were female, so that's a limitation in this study, and of course there was no substance use disorder only group. Now, the results from the study were fairly interesting. To explain these results, I'm going to use the acronym BPD for borderline personality disorder, SUD to refer to the group that has borderline personality disorder and comorbid substance use disorder, and of course control for the control group. So here with the results, we see there was no difference between BPD and SUD in terms of impulsivity, affective dysregulation, self-harm, or suicidal ideation. And there was no difference overall in the severity of BPD symptoms. Now, of course, there was a difference between BPD and SUD and the control group. But this study was really looking at that question I mentioned before. Does the comorbid substance use disorder with borderline personality disorder exacerbate the symptoms of borderline personality disorder? And these results indicate that they don't. Now, there was one significant difference found here, and that was that individuals with both disorders had a much higher comorbidity rate with antisocial personality disorder, over 2 times as high as compared to the BPD group. So if we look at the results of this study, and we look at research that occurred prior to this and some research that occurred after this, we really see what looks like mixed results. But it's important to remember here that this study had some limitations, which I mentioned, and also it was only looking at those borderline personality disorder symptoms. And there are a lot of other symptoms associated with substance use disorders that, of course, were not studied, like the impact on physical health, the risk of motor vehicle accidents increasing, risk of violence increasing, risk of criminal offending increasing, and the financial impact of substance use disorder. So there are a lot of other factors that weren't considered in the study, but specifically just looking at the borderline personality disorder symptoms, they didn't appear to be different. So when I consider this study and I consider all the other studies on BPD and SUD, I'm still inclined to believe that comorbid BPD and SUD results in more problems than just borderline personality disorder alone. Poorer treatment outcomes, more difficulty in terms of recovery, and just greater symptomology in general. This particular study didn't find that, but in general, if we look at all the research, I still think it's reasonable to believe that comorbidity does lead to more problems. I hope you found this description of borderline personality disorder and substance use disorder to be interesting. Thanks for watching.